Tell us about healthcare. What are your thoughts on healthcare and healthcare reform?
The current bill, I believe, needs to be either repealed. We need to either defund it. We need to get rid of this bill somehow. And let me talk about the problems with the bill. First of all, it's unconstitutional. I don't believe that there's any provision in the Constitution that authorizes the federal government to require me or you or anybody else in this country to buy a product or service. And in this case, they've stepped over that line with the health care bill. The Interstate Commerce Clause does not give them that authority, nor does the taxation authority under the that's given to Congress. That is also not another argument for the constitutionality of this health care bill. So from the outset, I believe it's unconstitutional. The second thing is, when they started the debate on the bill, President Barack Obama came out and talked about how the objective for this bill was to control health care costs. And they have absolutely failed in controlling health care costs. So let me be specific. President Barack Obama said that we were going to provide more services to more people at a lower cost. If you take an Econ 101 class, you'll find that that's not a feasible alternative. You can't provide more services to more people and lower the price unless you create a dramatic increase in the supply of the services being provided. And that's not what we have today. So as a result, what you either get are shortages or higher prices. And that's exactly what the health care bill is going to impose on us. If we're going to, I believe that we do need to have reform in health care. But I think the reform that we've approached through the most recent health care bill is the wrong type of reform. I think the reform that we do need to approach has some basic principles. So for the first one is that there's lots of different models that can work, and I think that the states have an opportunity and should have the opportunity to continue to essentially run experiments and figure out what's working and what's not working. Massachusetts has proved that their model did not work. At the same time, we have Indiana, who was successful in getting 70% of their public, their state employees on high deductible health plans with health savings accounts. And when the state employees recognized that the money in the health savings account was their money, they actually were a little bit more judicious about how they spent their own money. And the health care premiums in the state of Indiana went down in from 2009 to 2010. I think that that's a success. The state of Utah is working on trying to solve some of the healthcare challenges that we have in our own state through a healthcare portal and through some other programs that I think are within the jurisdiction of the state, and they we should not be circumventing them or essentially rendering them moot through the federal healthcare bill. A couple of basic principles I think will help us in our efforts to manage the costs of health care. First, we need to have pricing transparency. I think it's important for people to understand what the cost of the service that they're consuming is. Even if their insurance is helping pay for that, I think it's important for them to recognize what the cost of that insurance is. The second thing is portability, and this is the idea that we need to decouple health care from employer-sponsored programs, and also ideally under the right set of circumstances, if I move, I should be able to take my health care with me. If I move from one state to another, it would be nice to be able to take my health care with me if I chose. And then the other one, so we've got pricing transparency, we've got portability, and then the other one is more choice. And the federal health care bill takes away choices that are available to people today. We need for people to be able to have more choice and more discretion about their health care coverage. And that means if somebody wants to have a high deductible plan that's a true insurance type of a policy, then I think that that's okay. If somebody wants to have a very comprehensive coverage, I think that that's also okay. The point is that consumers should have more choice, not less choice. Those are the type of principles that will actually reduce the cost of health care, because now we're engaging consumers in the health care cost portion of the cost debate. One last comment, and I think this is relevant. There's been a lot of talk about tort reform. I'm for limiting punitive damages. I think that there's an important principle at play that we should protect people's right to sue in the event of medical malpractice, but I think that we can reasonably limit the punitive damages and still protect people's right to seek redress under the law.